Now let's look at the waves you'll be learning. The 5 waves of the heart. The P wave, the Q wave, the R wave, the S wave, and the T wave. Collectively, they are referred to by the super clever name PQRST. So let's talk about each wave, what they should look like, and what actions they represent. The P wave signifies atrial depolarization, which leads to the contraction of the atria. The P wave is the first wave of the heart cycle. The P wave is present, regular in timing and shape, and there is one for each QRS complex. They should be round, not flat, and their measurement should be less than 0.10 seconds, which is no more than 3 small boxes in duration, and no more than 1 square high, which is 0.5 millivolts. The QRS complex represents ventricular depolarization. These 3 waves occur in rapid succession and represent the electrical impulse as it spreads through the ventricles. The QRS complex plays a big role in clinical diagnosis. The amplitude, duration, and morphology of the QRS complex are extremely useful in diagnosing various heart ailments, including the presence of a previous myocardial infarction. The T wave represents the repolarization or the recovery of the ventricles. Like the Q wave, the morphology and duration of the T wave are also crucial in ECG interpretation, as it is used for diagnosing pathology and assessing the risk of life-threatening ventricular arrhythmias. Now that we've covered the 5 waves, let's examine the intervals. In this segment, we'll be looking at the PR interval, the QRS interval, the QT interval, as well as the QTC and its importance. Similar to how musical steps, thirds, fifths, and octaves produce specific sounds, the ECG provides insights into the heart's performance through measurable intervals, offering valuable information about its functionality. Let's start with the PR interval. To evaluate the length of the PR interval, start measuring at the beginning of the P wave until the beginning of the QRS complex. Count the small boxes between their measurements. A normal PR interval should be no more than 0.14 seconds, or 3 to 5 small boxes in duration. Prolonged PR intervals, as seen here, could indicate issues such as first-degree AV block. A shortened PR interval, shown here, could be an indication of Wolff-Parkinson-White syndrome or other heart arrhythmias. So always be sure to analyze the duration, height, and morphology of the PR interval. Next, let's visit the QRS interval. A normal QRS interval indicates that the heart's ventricles are activating within the expected time frame. The normal duration of the QRS complex is between 0.08 and 0.10 seconds. This should represent less than 3 small squares. A QRS duration of greater than 0.12 seconds, as seen here, is considered abnormal. A wide QRS complex can be associated with an increased risk of ventricular arrhythmias or other factors that affect the heart's electrical conduction system. The QT interval is measured from the start of the Q wave to the end of the T wave. It represents the time it takes for the heart to contract and refill with blood before it beats again. A normal QT interval is between 0.36 and 0.44 seconds, or 9 to 11 boxes, as seen here. A prolonged QT interval is an irregular heart rhythm and reflects a disturbance in how the heart's bottom chambers send signals. It should be noted that the QT interval is frequently referenced in terms of QTC, which is a corrected form of the QT interval that adjusts for the heart rate. A normal QTC range is from 350 to 450 milliseconds in adult men, and from 360 to 460 milliseconds in adult women. However, 10% to 20% of otherwise healthy persons may have a QTc value outside this range. A prolonged QTc interval may be caused by age, sex, genetic disorders, medications, body mass index, and common genetic variants. Let's now take a brief moment to review what we've covered so far.